Hi, and welcome to today's Daily Chronicle. Today is October 3rd, 2024. AI can generate recipes that can be deadly. Food bloggers are not happy. Apple released its iOS 18 this month, the update which came with release of the latest iterations of the iPhone, Apple Watch, and AirPods. Includes expanded applications of artificial intelligence called Apple Intelligence. Apple isn't the only company to integrate AI into its operating system. Samsung's S24 devices and the UI 6.1 update included Galaxy AI supported elements, and Google phones will soon feature Gemini AI 2. Many companies have advertised a feature in their newer phones that lets users utilize AI as a recipe generator assistant. In the Apple Intelligence demo, a user asked Siri for a dinner party meal plan with ingredients they have, and the AI returns a list of recipes using those ingredients. While that seems convenient, most of the press-ups to this point about the relationship between AI and cooking has been negative. For years, chefs on YouTube and TikTok have staged cook-offs between real and AI recipes, where the real chefs often prevail. In 2022, Tasty compared a chocolate cake recipe generated by GPT-3 with one developed by a professional food writer, while the AI recipe baked up fine. The food writer's recipe won in a blind taste test. The tasters preferred the food writer's cake because it had a more nuanced, not too sweet flavor profile and a denser, moister crumb compared to the AI cake, which was sweeter and drier. AI can be dangerous too. Last year, Forbes reported that one AI recipe generator produced a recipe for aromatic water mix when a Twitter user prompted it to make a recipe with water, bleach, and ammonia. The recipe actually produced deadly chlorine gas. With AI-generated recipes, casual cooks may risk a lousy meal or a life-threatening situation. For food bloggers and recipe developers, this technology can threaten their livelihood. Sarah and Caitlin Leung are sisters who make up one half of the families behind The Walks of Life, a food blog focused on sharing recipes, kitchen exploits, and travels. They started the blog in 2013 with their parents, Bill and Judy. Recipes for The Walks of Life began in what Sarah refers to as the ideation phase. Sometimes we have a group conversation, she says. Sometimes it's about fulfilling requests for recipes that we were asked for by readers. Sometimes it's a totally new and requires a lot of research and experimentation. Going out to restaurants to eat that dish, watching videos, or scouring the Chinese internet for ideas. After an idea is conceived, the Leungs will test a recipe up to 40 times. It took my dad like a year to come up with some of his recipes, Sarah said. All 4 family members have to sign off on each recipe before it gets published. We know that our readers are trusting us with their ingredients and time. So we try to make sure our recipe not only works, but also reads well and is easy to follow, Sarah continued. The recipe development process is also about cultural connection and understanding for the sisters. We had the experience of realizing that we didn't really know how to cook Chinese food that well, Caitlin said. All that is really reflected in the blog. We're always still learning. and always trying to make sure we're finding new techniques and ingredients. The stories that surround these recipes and the connections that we make with people through these recipes, it's so deeply human, Sarah says. That why the sisters are skeptical of AI-generated recipes. The machine doesn't eat and the machine can't taste. So what is it? Andrew Olson believes AI has a place in the recipe development space. He's a software engineer who develops recipes for his food blog, One Ingredient Chef, which has recipes focused on featuring one whole unprocessed ingredient. In 2019, Olson began experimenting with GP2, a rudimentary version of the ChatGPT software. I was already thinking about how it could be used for recipe development and to help people come up with new creative ways of cooking, Olson says. In 2023, he released DishGen, a tool that harnesses AI for cooking-specific outputs. On the website, users can input a list of ingredients to generate a recipe that looks just like one from a cookbook. Each recipe even includes a headnote with a sense-based description of the final product and suggestions for when and where to serve each dish. Within the recipe, there are little flares that evoke the recipe copy style. Cheese is sprinkled generously, textures are harmonious, and muffins are wholesome. Premium versions of the software even generate images of what the recipe's final product could look like. Olson is aware of the negative press. Google's telling people to put gasoline in their pasta, he says. So DishGen has focused a lot on safety. If you provide ingredients that have toxic combinations, like the components of chlorine gas, the website will not generate a recipe, instead sending a short error message. The Loongs don't think AI recipe generators can replicate the sensory experiences and account for the same variations and special touches that human recipe developers can. What blend of meat are you using? What seasonings are going in for the right amount of meat? How much salt is there? Is the salt affected by the addition of cheese? Which is salty? Because of the AI isn't eating or tasting the food, it instead amalgamates content pulled from the internet and uses pre-existing human-tested recipes to inform the recipes it generates on its own. These companies are taking content created by real people, not giving credit or attribution or any kind of compensation to the people that created the content to train their AI models, and then competing directly with those people who created that content. So it's a huge sort of existential threat, Sarah says. Olson sees it differently. So much of recipe development is getting inspiration from other recipes you've seen. Like, oh, that's cool, but I could make it a different way. Or I could add something else. I don't see this technology as any different, he says, but they're getting inspiration from what's publicly available, but they're not plagiarizing it or reproducing it word for word. I'm not totally doom and gloom, Sarah says. AI, I think, it can be used in a brainstorming context. You could talk about storage, how long this condiment could be stored in the refrigerator, or you could talk about this particular ingredient and elaborate on it. Olson agrees. I think food bloggers could use AI to be more creative, to come up with new ideas, he says. But I don't think the technology is there to the point where you can have an entirely AI-generated blog, although that would be a cool concept. Maybe someone should try it and see how it goes. As the loons prepare for AI technology to reach that point, they are making sure their blog won't be mistaken as AI generated by leaning into their family stories. Many casual cooks have long complained about the lengthy and sometimes irrelevant stories they have to scroll past to find a recipe in a blog post. Weirdly enough, Sarah notes, I think that people are going to be looking for those markers that a person created, like this is a story. Marburg is an especially scary virus. How scared should we be of Rwanda's outbreak? In this 2014 photo, a Kenyan medical worker from the Infection Prevention and Control Unit at a Nairobi hospital wears full gear when bringing a meal to a man in quarantine in isolation housing after coming into contact with a carrier of the Marburg virus. Do not continue your daily activities. If you have a high fever, a severe headache, diarrhea, or vomiting, urged Sabine in a press conference this weekend. If you are healthy, live life as normal and do not panic, he said. But those feeling sick must seek immediate medical attention. Sabine is Rwanda's health minister, and his country is in the grips of the first ever outbreak of the deadly Marburg virus. The virus comes from fruit bats and is in the same family as the Ebola virus. There are no known treatments or vaccines, although supportive care like IV fluids is helpful. The death rate can be as high as 88%. With more than 27 cases so far and 9 deaths, this outbreak is already the 4th largest Marburg outbreak ever recorded. The World Health Organization has deemed the risk of this outbreak as very high at the national level, high at the regional level, and low at the global level. Jennifer McQuiston is the Deputy Director of the Division of the U.S. Centers for Disease Control and Prevention that studies lethal viral diseases. She says whenever she hears about patients showing up with symptoms like a high fever and blood and vomit or stool, it sets off alarm bells in her mind. A whole host of serious viruses can cause what's called a viral hemorrhagic fever. Think Ebola and yellow fever. When this was confirmed as Marburg, it solidified these concerns, she said. There are a number of factors, she and other experts say, that make this outbreak particularly concerning. But there's also a silver lining and a bit of reassuring news. A lot of cases all at once. McQuiston says one of the first things that caught her attention is just how many Marburg patients there were. More than 24 when the outbreak was first announced by Rwandan health authorities on Friday. We're concerned about the number of cases that got diagnosed very quickly, she says, noting that it can take as long as 21 days between exposure and the onset of symptoms. That indicates to us that it's probably even been circulating for a few weeks. This could have happened because Rwanda has never reported Marburg cases before, which would mean that the healthcare professionals weren't initially thinking about testing patients for it. That's likely because many of the symptoms, like a high fever, can easily be caused by other ailments. Knowing what's happened in the first important step so that you can put it in right prevention measures, McQuiston says. That is happening now. Medical professionals are advised to put on impermeable gowns, respirators, and double gloves when dealing with a possible Marburg patient, and Rwandan officials have set up hand-washing facilities so the public can help prevent the virus from spreading further. The other worry with the high number of cases is that the virus might have had time to spread in ways they haven't even begun to understand yet, says McQuiston. In past outbreaks, the virus comes from a bat, likely through contact with their urine or other excretions, or from eating the same fruit that an infected bat nibbled, for example. But a few of the past outbreaks didn't have a clear bat link. So there's speculation that there could be an intermediate host. For example, a bat gives the virus to a monkey or pig, who then passes it on to a human who consumes the meat. And a person who's infected can spread the virus to another person. However, past outbreaks have been relatively small, in part because patients die so quickly and the virus does not transmit through the air. Healthcare workers are hit hard. Second major reason for concern is that 70% of marker patients in Rwanda so far are healthcare workers. Since the virus can spread from person to person through contact with bodily fluids, blood, vomit, stool, saliva, and even semen, for example, McQuiston's guess is that missing the initial diagnosis meant the healthcare workers in the past few weeks were likely caring for one or more Marburg-stricken individuals, but didn't suit up in protective gear. Now Rwandan officials are taking action. They've identified and are monitoring about 300 contacts of Marburg patients to see if they've contacted the virus. Their response has drawn praise and some questions. Dr. Abrar Garan, an infectious disease postdoctoral researcher at Stanford University, says that when he heard Rwandan health officials tell people with symptoms to go to their nearest health center, he found it a risky approach. He worries that patients might take public transit, putting others in danger, and showing up at a hospital waiting room could put other patients and clinical staff at risk of exposure until a diagnosis is confirmed. Instead, Karan says it would be important for community health workers to get to people's homes. That way, they can wear protective gear when collecting samples for testing and help arrange transport to a unit designated specifically for Marburg patients, he says. It's in the capital. The Marburg virus, which is named for the city in Germany where scientists first became ill with the disease in 1967, when handling monkeys from Africa and typically found in Egyptian fruit bats who live deep in caves. Cases usually occur in remote areas. Someone might go into a cave as a miner or to collect bat guano to use as fertilizer and get exposed to the virus. But cases in this outbreak aren't confined to a remote area. Instead, patients have been identified in 7 of Rwanda's 30 districts and is in the capital city of Kigali. Karan says the worry is that through human transmission, the virus could quickly spread onward to other places. It's already hit a transportation hub, he says. You have a lot more movement between countries and between continents. It's easy for someone who has been exposed but is not yet symptomatic to jump on a bus or plane without realizing they are carrying the virus. Indeed, WHO confirmed in a statement that at least one person who was in contact with a Marburg patient has already traveled to Belgium. The statement said, appropriate response measures have been implemented. Rwandan officials are already doing contact tracing and have called for limiting attendance at funerals for Marburg patients to 50 people. This restriction echoes to Ebola crisis. When family members who clean the body or had other physical contact with the corpse were at risk of exposure to various laden bodily fluids. The U.S. is having embassy staff in Rwanda work remotely and alerting physicians domestically about the situation. In the West African Ebola outbreak, 11 people in the U.S. were treated for the virus, most of whom caught the virus while abroad. Rwanda is a place where a lot of United States healthcare workers and clinicians go to provide aid or do mission trips. And so I think tracking who's been over there and making sure that they are monitoring their health and when they come back is an important thing that we're actively doing right now, says the CDC's McQuiston. An opportunity for progress. The lack of vaccines and treatments designed specifically to help Marburg patients is a major challenge, but outbreaks can offer opportunities for testing. With Marburg, it's very hard to study the vaccines without cases. And so in a setting like this, you may be able to deploy the vaccines and figure out vaccine effectiveness, says Karan. There are Marburg vaccines in phase 1 and 2 development. McQuiston says there are active discussions about whether vaccines could be tested in this outbreak. Hambach, executive secretary of WHO's Strategic Advisory Group of experts on immunization, says if this outbreak is going to be used for a vaccine study, preparations would have to move very fast. And though infectious disease experts are worried, they say they feel some reassurance because of Rwanda's robust healthcare system. We believe that Rwanda has the capacity and the ability to stop this outbreak very quickly. We believe that Rwanda has the capacity and ability to stop this outbreak very quickly, says Brian, the World Health Organization's representative to Rwanda. But McQuiston admits that Rwanda's health system is struggling a lot, with an ongoing mpox outbreak as well. Our CDC staff are stretched quite thin as we think about how do we mount dual responses. And I can only imagine that in Rwanda, where both of these outbreaks are occurring, but they also have malaria and a lot of other health concerns. And that it creates a situation that I think stresses their health system, she says. Karan says it will likely take several weeks before it's clear where this outbreak is heading. We've seen other Marburg outbreaks have been small and then got under control, Karan says. I hope that's what happens. On a Tennessee street hit hard by Helene flooding, strangers show up to help. Newport, Tennessee. Across a winding road, about a block away from the Pigeon River, an entire row of homes stand emptied out. Front yards are mud pits piled high with ruined furniture, ripped out flooring, and drywall. Inside one open front door, Don Reeb is bent over with a nail remover, pulling up the subfloor of the one-story home he owns. The day Tropical Storm Helene hit, the person he rents the home to sent Reeb's video as the water rose, yet Reeb was still in disbelief, he says. I just could not visualize in this house, the furniture and the refrigerator floating up to the windows, he says. But that's exactly what he saw. A mark on the wall shows the water rose above his waist. Reeb took down wood paneling, drywall, and laminate floor, and all the furniture is gone. There is a strong, musty smell in the air. Don Reeb on the right and his friend Richard Greenlaw in front of Reeb's home. They've been clearing it out with help from volunteers after it took on 5 feet of water. Like so many others, Reeb has no flood insurance. When he bought the house 5 years ago, he was told it did not qualify because of the risk. Although longtime residents say they've never seen the river swell so high, Reeb estimates replacing absolutely everything will cost $50,000. Oh, it's gonna hurt. It's gonna hurt, he says. Reeb knows he's lucky. The house is standing, and he can do the rehab himself. He's also pleased the place has been stripped down so quickly, which happened with a ton of unexpected help. The day before, a large group of strangers just showed up on his block, going door to door offering to clear out and clean up. Recovery from Helene's destruction has been slow in the mountainous areas across the region. President Biden on Wednesday deployed 1,000 active duty soldiers to North Carolina. He says they will speed up delivery of life-saving food, water, and medicine to isolated areas. As people wait for more help, the kindness of strangers has been one small solace amid devastation few could imagine. Those not hit by Helene are connecting on Facebook and creating an informal network to help their neighbors. On this street that was meant a steady stream of people volunteering their time and labor. A few houses down from Reeb, an orange forklift dumps a mattress and wooden dresser onto a truck bed and smashes it down. The operator is 22-year-old Tyler Venerable, whose home is safe on the other end of town. Tyler, operating a forklift at Trudy Hall's home, he and his colleague will haul her belongings to the dump. I have a business here, have this equipment, and there's people in need, so we're just going to, give back to the community, he says. He shares his number at the dump with those lugging one item at a time. Vernable knows some friends from high school who've joined in on cleaning out homes. He sees other people pass out cleaning supplies and jugs of water so people can flush toilets. I just think that's what we're supposed to do. I'd be upset if I was sitting at the house, he says. The owner of the house he's at now is sitting on the front porch, watching every single item of her longtime home get carted away. Trudy Hall, 56, says that the help she's gotten from strangers started the day of the storm. Her next-door neighbor called to say that the water was rising in her basement and told Trudy to get her dog and bag ready and get out. Trudy says she had no idea where to go, so the neighbor gave her the number of a man up on a hill who took her in and treated me like family. Hall has two sisters who were also flooded out. What are the odds? She says. She's now living with the fourth sister. Hall is a certified nursing assistant at a nursing home, and her co-workers have also stepped up with support. So have their relatives, including an 81-year-old father-in-law who helped clean out her house. How about that? People are good, she says. She cannot imagine a future anywhere but right here. I'm going to be back in this house, girl, she says. I ain't a quitter. Of course, it's a big hit financially, and as we talk, a tear slides down her cheek. Oh, honey, I've been crying since this happened, she says. It's all good. We're all alive. Still, she's not sure exactly how she'll manage, but is determined to do whatever it takes. As my brother said, room by room, we'll get it done, she says. We will get it done. As we leave, a co-worker brings Trudy lunch, and two women from a church show up with bags of wipes, water jugs, and cleaning supplies.